A Facebow is a very useful tool to transfer information about the upper jaw of your patient to the upper member of the articulator. Now, let's imagine that you have a patient who has a cant. And what is a cant? They are not parallel to the floor with their teeth. They are maybe like this or they may be like this. Now, you need to send that information to the lab, especially if you're doing any kind of anterior aesthetic work or you're doing a full mouth rehabilitation. You need to send the information of that cant to the lab. So what happens when you use a Facebow is your patient is canted this way and your bite fork is going to go in over here and you're going to send it to the lab, and when the lab articulates this cast, they are going to articulate it with the same cant. Now, why is this an advantage? Because now the lab knows that this side is going to be a little bit short and they need to wax up to lengthen this side a little bit more than that side so that the occlusal plane is parallel to the interpupillary line and you get good aesthetics. Now, if you didn't send the Facebow and the patient has a cant, what is the lab going to do? They are going to just articulate this absolutely flat parallel to the ground, and then when they do their wax up for your full mouth rehabilitation, they're going to make it longer and you're going to look at it in the mouth with the temporaries and you're going to say, hey, this side is way too long, and you're going to spend a lot of time cutting that back to correct the cant. I hope I've confused you enough. This is the Dental Review Guy signing off with a smile.